Hi, I'm Dr. Larry Klein. I'm a dentist here in St. Petersburg, Florida. And we get a lot of questions about being pre-medicated for heart murmurs in dental treatment. Great question, and one that's a little controversial but now being solved. The reason people are pre-medicated for heart murmur, a murmur itself is where the valves of the heart don't necessarily close at the proper time and sequence, and so sometimes a bacteremia can set up from the mouth and go actually and lodge on the heart, causing an infection called bacterial endocarditis, which can go anywhere from being sick to killing a person. There was a lot of concern in years past about dental procedures that actually cause this infection, and in the past people have been pre-medicated with antibiotics before any sort of treatment. As of April 2007, the American Heart Association has said that a lot of these pre-medications do not have to be done prior to dental treatment. Some of the indications that are not being needed to be pre-medicated now would be things for mitral valve prolapse, a murmur itself, where the functional or organic genital defects in the heart. Those are all now not needed to be pre-medicated. There are still several that are pre-medicated, and that would be anyone with previous history of endocarditis, people that have had a serious congenital heart defect, and also people that have had a valve replacement. So if you have any other questions concerning pre-medication for a murmur and what the American Heart Association recommends, please get in touch with me, Dr. Larry Klein, here in St. Petersburg, Florida.